Hi everybody, it's Mike here from TwoDads UK. We have another one of our sessions which I'm really excited to be showing you today. Reason being is that I'm talking to one of the consultants from Wessex Fertility, part of the fertility partnership based in Southampton. And I've met this lady before at a previous event some time ago. Duke was barely weeks old, I believe. But this particular topic is a real fascinating one. So we're going to be talking about fertility evolution and future families. So I'm thrilled today to be joined by the absolutely adorable Dr. Chantal Simonis. So how are you?
Hi, thank you so much, Mike. It's great to be taking part.
No, it's absolutely an honor to have you here. Now, for everyone that's watching, you've obviously had a very long day. So you're
Does
probably
it show?
no, not at all. Not at all. And again, I also want to say apologies for the question that I sent over. I added some years on you by mistake. So apologies for referring to the 80s heavily in our previous questions.
Yeah, you did.
So look, tell everybody a little bit about you and the role that you do at Wessex Fertility, please.
Well, in a very small potted history, I started off being a general gynecologist and obstetrician, and very quickly realized that I wanted to specialize in the fertility side of things. So did my obs and gynae training here in the UK, having come from South Africa many years ago, but not as many as you thought it was. And then after having done my obs and gynae training, I specialized doing reproductive medicine and started off being what we call a research fellow. So that was getting involved in talking to patients about IVF, but also at the same time doing some research so that I could write up some papers and do my thesis on polycystic ovaries. So I very quickly realized that this was the side of obs and gynae I wanted to stay in. I did not want to leave after I'd finished my research. So was really, really pleased when I got a phone call from Dr. Sue Ingemels, who's one of the consultants at Wessex. And I think she did this deliberately, knowing, and you know what this is like, because I had a son who was only a few weeks old at the time. And she said, would you like to come and chat to me about possibly going into the fertility world together? And I think I can blame brain fog for just sort of not really thinking. And before I knew it, I was agreeing to help her take over the clinic when the previous medical director retired. So it was the best decision of my life. I can quite easily say that. And it's been brilliant ever since then.
Gorgeous, thank you. And in terms of your love for reproductive medicine then, so what was the pull to go into reproductive med?
I think for me, it's a combination of factors. So the fact that you, A, are making a huge difference to people, but B, that you are looking after people very often who are healthy, but are struggling to conceive. And they are often not looked after as well within the NHS sector, because people see a healthy couple who, don't have any other medical problems. And so that I think often couples who are struggling to conceive actually miss out on treatment. So I felt that it was a really worthwhile side of reproductive medicine to be in. And I think the joy, I mean, I still, to this day, still leap about the room when I walk into the office and I hear that someone's phoned in with a positive pregnancy test. Oh. So I don't think I'm ever going to lose that. And they all laugh at me at the clinic and they say, do you think you'll ever miss, having that? And I said, no, I always want to be able to get so excited about a result.
And quite rightly so. The work that you do, it's just incredible. I fair play for jumping around. I think that's wonderful. So I think for many then, I think if we're looking at how, I guess, fertility treatment in itself has evolved and how more people nowadays talk about fertility treatment, whereas they didn't in the 90s. You've obviously seen how IVF has or was a taboo subject. What was your experience like of treating patients in the 90s? How, we're more open now in terms of what we talk about. What was it like back in the 90s?
Well, I think, and for me, actually, it was sort of even after the 90s was when I started getting involved in the fertility side of things. And I distinctly remember, things like couples needed to be married to have fertility treatment. I mean, how outdated. You sit here now and you cannot believe that actually happened as short a time ago as 20 years ago,
Crazy.
because the world has changed so much. So for me, the openness, the ability to talk about it has come about not only because of social media, but social media has had a lot to do with the fact that people do talk about things. And I think within the whole fertility sector, not just for us at the clinic in Southampton, but all of us being able to talk about fertility, to be able to say to couples, when you're having difficulties, sometimes you need a bit more support. Talk to our fertility counsellors. Trying to take the stigma away from it is what's so important.
Yeah.
But even just today, I had a consultation with a new couple in their 20s. And, as I got to the end of the consultation and I said to them, you will find you get a lot of support from everyone in our team. It's not just the counsellors. I said, but do you have anyone that friends or family that are going through IVF or have had IVF? And I could sense that, it was hard for them to even think about it. And they said, yes, we do. But, it's such a hard thing to talk about. And I said, it is difficult. But the more you start to talk about it, the more you'll realize how many other people are in the same boat as you, who are actually experiencing the same things. And I think actually that the one part of it that for me is really important is trying to get the chaps into the discussion.
Yeah.
Because very often, and not just the chaps, the partners, whoever the partner is, often we focus so much on the person who's having the fertility treatment that we neglect the person who is there to support them, who is their partner. And I think we've got to remember that there's often another person that needs to be looked after, not just the patient.
Yeah, absolutely, and we have first-hand experience of that. Even in our situation, depending, whose gametes are being used, tends to be that person where the care's directed at, and you do often get forgotten about. And you're right, and generally just getting, or as well as getting men involved in being more aware of their fertility, or just being engaged with the clinic to even understand their own fertility status is also a real rising challenge that I'm seeing a lot of clinics and third parties and communities are trying to do.
And I think for particularly for men, you come to a clinic and you look at gynecology and you look at fertility clinics, and there's an awful lot of women.
Yeah.
There's not a lot of men working in those sectors. It's changed so much compared to what it was years ago, where it was only male consultants. Now there are a lot of women, and our nurses are female, our embryologists, a lot of them are female. And I think that can be a little bit uncomfortable for a male partner to come into the clinic and feel it's so female orientated. So it's important to remember how it's making them feel.
What was treatment like and success rates like then, back when you first started?
The success rates were lower. I mean, I remember us being excited if we had, a 20% success rate. And nowadays we're quoting, for people who are under 35, success rates of above 40%. So it has increased significantly since then. The treatment itself, interestingly, although we do have more modern ways of doing treatment, and we have things like the antagonist cycle, which is the more patient-friendly sort of IVF. But there's the long protocol that we still use to this day, was what we used all the time when I first started doing IVF. And it hasn't changed at all.
Wow. It's so apart from a few fancy machines, the crux of it still is exactly the same.
Yeah, I mean, the machines have changed, and there are some pretty spectacular bits of kit that are in an embryology laboratory, and time-lapse imaging is one of the things that really has changed the sort of the whole playing field for IVF. But apart from that, the bread and butter of it is the eggs, the sperm, and the embryos, and that is the same as it was before. It's just that we're refining what we can get in terms of creating embryos and getting, what we need is genetically normal embryos. And unfortunately, you can't make that happen, but you can now start to look at how normal they are.
Mm-hmm. Fascinating. And you mentioned it a minute ago, which again, it's so hard to believe that 20 years ago, the restrictions on who could have fertility treatment under the particular act and legislation compared to where we are now. Do you remember when that changed, or can you remember when fertility treatment wasn't just for married heterosexual couples?
So I do remember when I was first a research fellow in 2000, and at that time, patients very rarely were unmarried, very rarely.
Mm-hmm.
And they were. It was expected that you would be married, and if you weren't married, you had been together and shown commitment to a relationship for a certain length of time. I mean, oh my God, how old-fashioned was that?
Enduring relationship, I think the words used to be. It was an enduring relationship.
Enduring relationship, exactly. And so in 20 now, 20 years down the line, to me that there should never be a question about whether anyone's relationship status is the issue about whether they have fertility treatment or not. Obviously, having the HFEA's guidance and the various processes that we need to go through to make sure that you are confident that the family you're creating is going to be in an environment where we haven't got concerns about medical conditions, that people might have genetic conditions that we don't know about, that they could pass on, that they have infectious diseases that they might be. All of that, I can understand exactly why we have those regulations. But judging people's right to have children based on their relationship status is luckily consigned to the bin.
Yeah, absolutely. And thank goodness. And thank goodness.
Absolutely.
So again, being a bit of a surrogacy ambassador and the work that we do within that sphere, the Surrogacy Arrangements Act of 1985, formed after baby Cotton was born in that year. Surrogacy was a treatment that clinics tried to avoid, really, because of risks associated to it, and the government at the time, their view on surrogacy and all of that. How can you remember, I guess, your first surrogacy patients and how that's now changing?
I can. I mean, I've got one particular couple who are very sort of foremost in my mind, for the simple reason that she was particularly keen to try and make changes to the laws so that things could be made easier for people who came behind her. And one of the things that struck me so much, and this must have been, it was probably about 2008, because it was just after I started at Wessex Fertility, and I started there in 2007.
Okay.
And I remember I still will never forget the moment she came in to bring her baby to meet me. And she said, "Oh, do you mind if I breastfeed?" And I said, "It would be the best thing ever if you breastfed." I get goosebumps.
Oh, that just gave me goosebumps.
Just thinking about it. And what was
that me well up.
No, it was making me well up. And that was, that was amazing. But the other thing that I remember so clearly about her was that she started various sort of petitions to get people to sign, because what she was saying was, the person who had her surrogate host would get maternity leave, having given birth naturally to this baby and feeling right as rain and being ready to go back to work 3 days later, whereas the child's mother was not able to get any maternity leave
Yeah.
whatsoever, and she and her husband were absolutely shattered, you know, having to work and looking after a newborn baby. And she was really keen to see what she could do to get petitions going. And I remember at the time sort of saying, yeah, I'll talk to my MP, I'll talk to whoever you want me to talk to, because it's got to change. It's just crazy, that rule.
Absolutely crazy. And thank goodness it did. You know,
Exactly.
thank goodness for shared parental leave.
Yeah, because, you know, at the end of the day, and it was thanks to people like her that
Yeah.
just kept motivating to change it.
Yeah, incredible. What a gorgeous story. Thank you. Thank
Probably
you.
one of my favorite stories
Oh,
ever.
that's going to stick with me for sure. That is such a beautiful story. Thank you for sharing that one. I guess on the same topic of, you know, recalling patients then, can you remember when you first started treating same-sex patients?
Do you know, that for me, as I was sort of thinking about it earlier, I don't think of my patients as being same-sex parents. They are parents to me, and I'm creating a family. And so for me, I can't think back and go, oh, well, can I think of a same-sex couple? Because it's not like that. All my patients are my patients, and I don't distinguish between how they created their family.
Gorgeous. Yeah, thank you. Oh, we do love you. We do love you.
Yeah. Listen, if I can chat to you every night, it'll make my day great as well.
Let's do it. Let's do it.
No, we could just have a set time every
Yes, yes, we can. This is like therapy for both of us. It's brilliant. Let's step back in time again. So let's go back to when the Human Fertilisation and Embryology Act of 1990 was introduced, and the regulator then in, you know, at the HFEO in 1991. We touched on, you know, policies being introduced. You know, how do you think that changed the industry? I know obviously you were, you know, coming into it at that particular point, but, you know, from what you've seen, and even I guess how the codes of practice change as we go, how have you seen the regulation impact?
Well, I'd be shot down by some people for saying this, but I do think there is a huge value in having the regulation. I think it ensures that we, you know, have perfectly well qualified people doing treatment, that we have procedures in place to actually look after the patients and protect their interests as well. So I do think regulation has got a really good role to play, but I think sometimes it can become needlessly bureaucratic, and people can get a little bit bogged down with all the paperwork. And I think the HFEA have been doing a lot of work working with patient groups, trying to find out how to move forward and make the HFEA something that is more user-friendly. And I think they've done a huge amount of work. And I think in the last few years, certainly, I've seen it as a really positive aspect of what we do. So I think, you know, we've done well to have such a good regulatory body. You know, you look at places where there isn't regulation, and you do worry about who is looking after the patient's interests here.
Yeah, I totally agree. I think it wasn't until, you know, probably 5 years ago when I totally submerged myself in the fertility industry, and then understanding clinics that aren't regulated, and I guess the exploitation and the treatment, and how women and patients are treated in an unregulated world. It's frightening, really.
It is, and it's dangerous, actually. You know, at the end of the day, it can be dangerous for some patients, and so I think regulation is a good thing.
Yeah, agreed. Speaking of the patient forums, TwoDads UK are on the AFPO, which actually met today. So we actually had the quarterly meet today, which was really interesting. So they definitely are looking at ways to innovate sort of patient support. So you're absolutely right. So we touched on equipment and how technology is playing a role within a clinic environment. What do you think has been one of the more monumental technology advances within your role or within the fertility industry?
I think one of the things that has impressed me so much over the last few years has been time-lapse imaging and being
Mm-hmm.
able to actually, I mean, if I give you the example of years and years ago when I first started doing this, embryos, so the eggs were collected, eggs and sperm were put together. The following day, the embryologist would let us know how many eggs had fertilized. We'd phone the patients, let them know. And then, in fact, 20 years ago, a day later, we would put an embryo back, on day 2.
Wow.
And then, day 2 was when embryos were going back. And then for a long time, day 3. And
I never knew
since
that.
I've been, and now, we're at Blastocyst. And when we were doing day 2, 3 embryos, we didn't have time-lapse imaging, and embryos were being taken in and out of the incubators that we could check on them, see what they looked like, decide which one to go back. And all the perfect conditions that they needed to be in were being disturbed every time we had to take them out. So with time-lapse imaging, especially now where they are in the incubator for 5 days, they're not being disturbed. We've got these beautiful videos showing us what each of those embryos has done over the course of the 5 days. So we're able to better select which one to put back. Now, that doesn't tell us genetically that it's a normal embryo, but
No.
it certainly gives us a lot more information when you've looked at the video and you've seen its history across the 5 days. So I think that's fascinating. And, I love to look at the videos, and the patients love to look at the videos.
I know. It's one of my it's one of my most favorite videos that I've got saved on my phone, and it's Tallulah's embryo. It's that first.
And
Yeah.
yeah.
And we transferred at Blastocyst, so we were really lucky. But it's almost like her first selfie, and it's just that, and to show Tallulah that this is
you
created. It's just,
yeah.
I love it. Love the fact that we can show her that. What do you think's next then from a technology point of view? What, I've heard there's obviously the studies of, lambs being, in the manufactured type womb. What do you think is next for the industry?
Honestly, I'm not sure what will be next in terms of in the next few years. I think what is on the horizon perhaps in 20 or 30 years time is a completely different thing. And I think what people are looking at already is, can we take skin cells, blood cells, stem cells, create eggs or sperm from those early cells, and create families that way. And that is something that's being looked at already. That's not for 50 years time. I don't know how long it's going to take, but that, does change the whole environment, because it takes away the issue of you need an egg from a female, you need a sperm from a man. What is it going to do in terms of how we reproduce?
Amazing.
So I think it's fascinating, but it's scary as well.
Yeah, absolutely. Wowzers. And while we're talking about inclusivity, and when we were talking about sort of patient groups, what's really important to us and to anyone that's watching is it's obviously making sure that we're fully being inclusive with that patient flow. From a fertility preservation perspective, and in terms of for the trans community, needing more awareness, needing more signposted support, clinics that maybe specialize in trans fertility preservation, or even family building for the trans community. Is that something that you've ever had experience in?
Yeah, and in fact, just recently, I think just before lockdown, and then through lockdown, when I've been seeing patients remotely, I've been having discussions with young adults who are in the process of deciding exactly what they want to do. So, we prefer them to talk to us before they've started taking any hormone blockers. Because it's important to be able to explain the pathway and explain what is possible and what the future may look like. But I think the really difficult thing at the moment, and what I'm hearing over and over again, is that there is such a long time between being referred to the gender identity clinics and to have those sort of discussions. And I know there are one or two private clinics now that are starting up who will talk to teenagers who are wanting to talk about fertility preservation. And so we're very happy to talk to them and give them our information about what is available. But I think the really difficult part is the hormone blockers and having the treatment. I had a friend phone me the other day and say, would you be able to talk to a really good friend of mine? Her son is not sure about whether he wants to have fertility preservation or not, but has been told by the clinic that he's seen that it's not going to be an option. He has to wait another 3 years before anyone will talk to him, which is not true. People need to be able to come and talk. And at least get the information, because sometimes, I remember having a discussion with a really lovely girl when was it? This was before lockdown, who wanted to freeze sperm so that she would have an option in the future if she wanted to use it. And I said to her, well, do you know who you might be with in a few years' time? Do you know what your relationship might look like, and who you're going to choose to be with? And she said, I don't. I think it will be with a woman, but I don't know. And all of that is fluid at that point, because people don't know. But if you don't give them the option and you don't let them freeze sperm or freeze eggs, they may have those options taken away.
And it's dangerous, isn't it? It's just so just for having someone to talk to and go through those options and go through the facts, I think, more importantly.
Yeah, exactly. And in a sort of way that they can feel, they can ask questions that perhaps they wouldn't be able to ask anybody else. That's what we're there for, is to give information about it. So I feel really strongly that there needs to be more education, that we need to bring education about trans fertility preservation into schools. That's where we need to talk about it.
Absolutely agree. I couldn't agree with you more on that particular topic.
But there already is a lot happening, within the schools, and the various changes that have been made by law, actually, to what needs to be taught in secondary schools about sex education, relationships. So I think that is changing. I just look at my son, who's 15, and it's just absolutely the norm for them to talk about non-binary, all of that is just normal.
It's just their language. It's just their language, and how wonderful that it is, and it's us older generation that have had and been used to the labels and familiar with the correct language to use, whereas that age group coming through, that is the future of how we should be treating everybody based on how they understand it. It's
exactly.
I could talk to you for hours.
But I could talk to you for hours, but I can smell my dinner cooking in the background.
What have you got? What are you having to eat?
Well, in fact, I made a cottage pie last night with a kale and mashed potato top. And so I'm actually having warmed up cottage pie.
Wonderful. Well, look, I have loved this.
It's been great to talk to you, Mike.
And how you've been a dream. Thank you so much for everything that you do. Thank you so much for your passion for the industry, and just for what a wonderful consultant you are, and for the work that you do for everybody at Wessex Fertility. You've been an absolute joy. Thank you so much.
Thank you. And thank you for everything you and Wes do.
No worries. Thank you so
much. There are a lot of very appreciative people.
Thank you. Too kind. Thank you.
Have a lovely evening.
You too. Enjoy your food.
I'm going to.
Take care.
Bye-bye.